profound and I think devastating manifestations of this disease. So this is like, when you Google image itching in a child, this is the image that comes up. And I think, clearly not what we see when we see PFIC kids, right? Typically what we see is something more along the lines of this destructive kind of deep abrasions where these kids are really tearing at their skin because the itch is so severe. Itch is terribly frustrating because we, and when I say we, I mean the medical community, we still don't really know what exactly causes itch. And I think there are several theories. Many of them have data behind them, but we don't know for sure. And so this picture kind of tries to capture what causes itch, but there is some data that just the increased bile acids in the blood contribute to the itch. Autotaxin is another molecule that's been associated with itch. Lipophosphatidic acid, or LPA, is another substance that we think causes itch. And again, as you've seen in this picture, they put in a factor X, right? Because there's likely other factors that are in there because of different studies that have been done that show that it doesn't seem to just be one of these things, and or it's a combination, and or there's a factor we still haven't described. Whether or not that factor acts on peripheral or central signaling to kind of signal the nervous system to cause the itch is still, again, somewhat of a debate. But I think that the more we learn, the more we are trying to understand how best to combat itch. But we still, by no means, are perfect at it. There are various medications that we will use to try to combat itch. And again, many, I'm sure, of the parents on this webinar have had children who have either been described, again, ursodeoxycholic acid, which is another medicine, or another utility of urso in patients with PFIC, rifampicin, which is a PXR agonist that increases metabolism and has an antibacterial effect, cholestyramine, which essentially acts in the intestine to bind bile acids so that they don't get reabsorbed, naltrexone, which is an opioid antagonist. I think a lot of people can relate to when they get morphine or another opioid. There's an itch that sometimes is associated with that, and so naltrexone is an opioid antagonist, has been shown to be beneficial. And then sertraline, which is actually an antidepressant or an SSRI, has also been shown in children and in adults to improve itch in a certain population. I think most of the time that the clinical approach is a trial and error. I think I've had many patients who I've tried on all of these medications only to start over and try again. I've had them on various combinations of these medications. I've had them on medications that I started, didn't seem to work. Went around the block, and when I came back, restarted a medication that seemed to have some improvement. And so itch is, one of the most devastating things to have to witness in a child, and it's one of the most frustrating things to try to treat. This is essentially the entirety of our armamentarium from a pharmacological standpoint. Again, Kyle, who's just joining us, will talk a little bit about some of the surgical aspects that we use to treat the itch. But from a medical standpoint, this is essentially where we top out, at least here in the United States.